of our webinar series called With Everyone Else, Fundamentals of Community Inclusion and Participation and Implications for Coordinated Specialty Care. Once again, my name is Liz Thomas. I'm an assistant professor in the College of Public Health at Temple and an investigator in the Temple University Collaborative on Community Inclusion, where we focus on promoting community inclusion and participation among people with psychiatric disabilities. My work within the center focuses specifically on young adults with serious mental health conditions, including those with early psychosis. I'll turn it over to Bodhi to reintroduce themselves and to Hannah as well.
Thanks, Liz. Hi, everybody again. I'm Bodhi Bodenhammer. I'm a certified peer support specialist in North Carolina, and I actually work on a first episode psychosis CSC team. I also wanted to let you guys know, not just that I'm here from the point of view of the peer support specialist, but also we're going to have some ways for folks who haven't made it to the other two. We have some chat. We'd love to encourage chat use. The raise hand feature, please use that, and we'll have some breakout rooms later. So we want us to be interactive. Please feel free to share as much as you can while we are presenting.
Hi everyone, thanks for joining today. I'm Hannah. I work with Liz at the Collaborative. If you need any help during today's webinar with anything tech related, feel free to send me a message and I can assist the best I can. After today's webinar, I'll also be sending out certificates of attendance and we'll share more information about CEs later.
Thanks, Bodhi and Hannah. All right, we've mentioned this before, but we are very grateful to the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR. They are part of the Administration for Community Living, and we're very grateful to them for supporting the research that we are discussing as part of this webinar series. Our agenda for today is to continue discussing some of these evidence-based fundamentals for promoting community inclusion and participation, and also discussing some examples and some ideas for how they can be put into practice within coordinated specialty care programs and other programs that serve young people with serious mental health conditions. As Bodhi mentioned, we do aim to make this webinar interactive as we did with our first two, so there will be opportunity for discussion and Q&A towards the end. And we will wrap up by discussing some next steps and a technical assistance opportunity that's forthcoming after this webinar series. So again, we'll talk about some fundamentals for community inclusion and participation. Everything that we're going to be discussing today, or at least these fundamentals that we're discussing today, are described further in a written document called Well Together. Hannah's going to share that in the chat for you if you haven't had a chance to take a look at it already. But it describes some of these evidence-based fundamentals that we're talking about today. So last week, we talked about fundamentals 1 through 5. These were things like community inclusion is important, that it applies to everyone. It requires seeing the person and not the patient. It requires promoting self-determination and what's called dignity of risk. And it requires focusing on multiple domains of mainstream life. Today, the first fundamental that we'll be discussing is fundamental number 6, that we need to seek participation that's more like everyone else. So here we see some characteristics of participation that is less versus more like everyone else. The first characteristic is whether participation is more institution or agency or program based versus participation that's more community based. An example of institution, agency, program based participation might be a movie night at a CSE program. This certainly is a very good thing, but it is participation that's more like everyone else. So for example, going to a movie theater out in the community would be participation that's more like everyone else. And that's really the goal in promoting community inclusion and participation, is getting people out there interacting with other members of the community. We can also look at whether participation is directed by staff versus whether it's directed by the individual themselves. So obviously participation that's more individual or person directed is participation that's more like everyone else. The last dimension is participation that promotes separation. For example, this might be a movie night, a game night, sort of programming within a specific mental health program versus participation that promotes association. So going out in the community and interacting with other people. Promoting participation that's more like everyone else often necessitates individualized supports to help people get out into the community and do the things that they want to do. And we've heard many great examples from CSCs about different ways that they're accomplishing this. First, a lot of young folks, a lot of people in general love animals. And so some have gotten involved in volunteering at animal shelters, SPCAs. And that, again, is an example of participation more like everyone else. These volunteer opportunities are open to any member of the community. Another example is exercising at a YMCA. We actually heard from a lot of CSCs that YMCAs were willing to provide discounted memberships for program participants. So if you have one of these in your community, they might be a great kind of partner. We've also heard from programs about local libraries and programming that's available to community members. For example, chess club. Libraries are often a great resource for free activities that any member of the community can participate in. Art groups, cooking classes were also discussed in conversations we've had with CSCs. Support groups. Now here we're referring not to necessarily to mental health support groups or support groups that only mental health service users might use, but really kind of support groups that specific communities could have access to. And then a final example was taking classes at a college or university. Many educational institutions can also be great partners. One example that really has stood out to me from conversations I've had with CSCs was that a local university was willing to allow program participants to come into a theater class and then be involved in a production at the end of the class. I thought that was a really unique and innovative example of a way that a CSC was able to develop that partnership and then get people out into the community. I think Bodhi was going to take this slide.
If I can ever find my unmute button. We wanted to address the building capacity to promote participation like everyone else, because we often hear from CSC's major barrier to promoting that participation is limited staffing, budget. That's a big one. Transportation. We talked about some of this in our first webinar too, is other resources that you need to engage young people in the community. The tendency becomes to try to reinvent the wheel more or less within the walls of the agency, within the confines of the program, but that doesn't solve the issue of limited resources, and it isn't sustainable necessarily for those folks to rely on the program rather than getting their sea legs, as it were, to get out into the community at large of their own accord, which is something that peer supports, actually, peer workers are focused on in general, is engaging with the larger community, engaging with resources outside of just the CSC program. And we, accompany people out into the community to help them practice and facilitate those skills they need to navigate social circumstances or community just events or whatever it is that is a barrier for them that we can help alleviate by being with them, being with everyone else.
Thanks, Bodhi. Really, really important role for peer specialists here. And really, and we'll talk more about this in some coming slides, but it can be really helpful to establish these partnerships with community-based organizations so that you don't have to reinvent the wheel within your own program. So next fundamental is fundamental number 7. use what we call emerging support technologies, the natural supports of families and friends, and of course, the engagement of peer supports. So first, a little bit about the emerging supports technologies. These are all principles that underlie evidence-based practices, such as supported employment, supported housing, supported education. And these technologies or these approaches can also be applied to supporting people with other areas of community participation. So being a part of a religious or spiritual community, for example, or dating, parenting, doing other things that are important to people that they want to be doing in their lives. These emerging supports technologies really emphasize rapidly assessing what people want to be doing and then getting them out into community spaces, doing the things that they want to do and providing supports along the way, versus trying to prepare people or making sure that they're ready for participation. We're really getting people out there and supporting them along the way. In terms of natural supports, although we know that people with serious mental health conditions, those with early psychosis, including young adults, use natural supports, supports from family members, friends, other unpaid individuals who are supporters. We know that their social support networks do tend to be smaller. And so our job in promoting community inclusion is to try to enhance people's identification of supportive people in their lives, and helping them utilize these natural supports to a greater degree. So here are some ideas for some things that teams can do to help clients build and make use of natural supports. The first is to support clients and family members to participate together from the beginning, rather than beginning with staff-assisted participation. Maybe there are certain skills or challenges that you anticipate a young person might have, or maybe they're just not feeling ready to go participate on their own. Family members and other natural supporters can be a great source of additional support for them while they're out in the community to help them utilize skills they're learning in the program, address some of these challenges, feel more comfortable out in the community. Another idea is to have alumni groups or have kind of graduated clients come back to lead groups or present their stories on panels during groups that are ongoing, and to share their positive experiences of community participation. I think Bodhi was going to talk a little bit more of an example of an alumni group they have at her Oasis clinic.
Yes, we actually have had people who had graduated from the Oasis program come back and speak to the multifamily support group and peer groups. We actually did one recently where a former peer of mine who I'd worked with for some 5 years was one of the two folks who came to speak. And it was wonderful to hear the conversation that was happening. I gave the alumni some questions to kind of help them tell their story. And then really it was a big Q&A session after that, and hearing the conversations that were happening between the current participants at Oasis and the former participants. Yeah, you really saw the encouragement, and they had brilliant ideas of ways of using community supports, like the informal supports. For example, one of my former peer had gone regularly to the same coffee shop and just practiced saying hello to the barista, just saying, hi, how are you? And he had these insights to his experiences of trying to talk to people in the community, which was very intimidating, that, I didn't have. He brought all kinds of wonderful experience to that group. So it's just another way that I guess seeing people succeed and getting ideas can help these participants gain a little of the courage they might need.
Thanks, Bodhi. Yeah, I think these alumni groups can be another great source of natural support for folks. The last bullet point here is about an approach called pods. It is an approach that our Q Collaborative has been studying and research, and Hannah's been more intimately involved in that pods project. So I'm going to turn it over to her to say a few words about that.
Or like Liz said, we at the Collaborative are piloting the PODS program. It is a program that mental health agencies can offer that brings people together who have a desire to do more in their community and build social connections, build more of those natural supports. It gives participants space to connect through shared interest around community participation. So things like volunteering, book clubs, going back to school, so that they can pursue those areas of participation together. And it really emphasizes that natural participant-driven participation. We're piloting this program with a bunch of agencies across Pennsylvania right now, and then plan to make it available outside of Pennsylvania post-pilot. So if you're interested in implementing in Pennsylvania or learning more, I'll put my email address in the chat right now.
Thanks, Hannah. All right, so our next slide is about peer support. So I definitely need to turn it over to Bodhi to talk more about this. They are the expert on peer support.
Thank you. So since peer specialists are champions of community inclusion and participation efforts, it's, because we know how to do that, because we've gone through the process of reintegrating and being connected to our community again after the experience of first episode psychosis or whatever it is, being in recovery means for your CSC participants. Someone else who has lived through it is usually the best and sort of support for a participant and a very important ambassador towards the greater community. We know about the resources that are available in our local areas, and part of our job is to find out more of them. We know how to access them. We have learned ways of moving around. We've gotten really creative at solving our problems and overcoming our own barriers. So hopefully that can help assist a program in working towards eliminating those barriers for their participants. And we understand just how important it is for our participants to figure out, how to be with other people, and how it's a medical necessity, and how crucial it is to a feeling of recovery that continues to grow rather than have problems repeatedly. Like it establishes a support network that continues to grow. So what was it? Nev Jones and colleagues put out a guidance manual, the picture that you see on the slide, that regards a variety of roles peer providers can have on a CSC team. Part of their roles could incorporate a focus on community participation if their focus hasn't been there, or if there hasn't been a lot of forward momentum, even though, the other providers probably have acknowledged its relevance and its importance. And the participants can be supported to provide informal peer support to each other when it comes to kind of like the PODS idea is encouraging. They kind of talk to each other, meet fellow participants. Maybe they make plans together or just ask how it went in a group, and we also do, at my clinic, we do a lot of events. We do events that are social more than just groups that are just support groups. We have social events that include the whole staff, the families, and the participants. We just had a big barbecue picnic this month. It was great. People were playing spike ball and someone had a badminton rack. It was really lovely. And then we also have like specifically peer events that are just for the young folks to talk to each other and share resources and go out. And we went bowling, and things like that. They were really excited to have a way to get out of the house. So what we can do is basically talk to our peers and use our own experiences and our connections to that community to help facilitate this community inclusion for the CSE program.
Thanks so much, Bodhi. So our next fundamental is Fundamental 8, providing support to family and other natural supports promotes community integration. Family members are critical in people's lives, and it's important that we support them as well because they are valuable resources to their loved ones. The evidence behind this fundamental is that family members of people with serious mental health conditions are also less likely to participate in the community compared to the general population. So they're working less, they're less likely to spend time with friends and engage in recreation and leisure activities, etc. And a big part of this is the time that they're spending caring for their loved ones. So because family members are such a critical resource for promoting community inclusion and participation, it's logical that supporting them with their own community inclusion and participation is essential. And there are a lot of strategies out there for supporting family members. For example, there's the family-to-family programming that are available throughout the United States for family members and other caregivers. The great thing about CSCs is that most programs already offer services to families. So many programs have family education or multi-family groups. And so providing education to families about the importance of community participation and helping them plan how to engage in different activities in the community together could be something that could be easily integrated into CSD services if that's not being done already. Many family members, as you all know, probably have concerns about the capacity for their loved ones to engage in community participation. So part of this education, part of this support to families could be to help families shift any unhelpful thinking that they may have about their young adult loved ones. Essentially sort of normalizing certain behaviors.
Okay,
like
that's what he's telling me. What do I renew?
Like many young people may not be very good drivers when they first start out, and this is a normal part of that young adult experience, and may not necessarily be related to the experience of psychosis. So really normalizing any of those concerns, and kind of emphasizing the key point that you don't know until you try. This also relates to supporting this notion of dignity of risk, that everyone has the right to make choices about what they want to do in life, these day-to-day life decisions. And everyone has the right to make choices that may end up being mistakes and to learn from them along the way. So we can emphasize with families that there may be greater risk associated with lack of participation than participation itself, and help families plan what to do to support their loved ones to address these risks head on versus avoid them altogether. Fundamental number 9 is that environmental barriers need to be addressed, identified and addressed. Those things outside of the individual that limit their community inclusion and participation. We've acknowledged many of these in our previous 2 discussions. Things like stigma, limited access to resources, transportation issues. And kind of focusing on these environmental barriers is consistent with what's called the social model of disability, which views disability as something that's not inherent to an individual necessarily, but a result of a poor person-environment fit. So the social model of disability really means that we need to pay attention to the environment, because these environmental barriers can have a huge impact on the lives of people with lived experience. And if we don't pay attention to the environment, we're missing a great deal of what we need to do to promote community participation and community inclusion. It's not just all symptoms or illness, it's really this person-environment fit. I think Bodhi was going to take this one.
Yes, I will, because we run into this. A lot of what I do is troubleshooting, and is collaborating with the team, because some of the major things, and we've talked about, we had a great discussion with the participants in previous workshops about the problems, which included individual disempowerment. So if you're, if you've internalized that you don't have any choice and that your voice does not carry any weight, then it can be hard to be motivated for young people to make those decisions or decide or even think about what they might want to do. Sustained poverty, of course, we all know low income is, and then generally having a lower income than the average population. It's harder for folks to find and keep jobs who are dealing with psychosis. And a lot of those jobs that we go back towards, it's like they're low paying jobs because someone doesn't think they can handle something else, or they didn't finish their degree or whatever. Transportation, a universal problem in a lot of places, because cars are expensive and a lot of our folks are afraid to drive, and public transport might not be widely available or reliable depending on where you are. And then there's the prejudice and discrimination problem. That's the stigma that comes from the outside that leads to the self-stigma. And why should I even try? And the first time you have a bad experience with a boss who you like decide to disclose to in order to get accommodations and it goes poorly, then it's discouraging to try again. But I guess we can talk about some of the ways that CSD teams can work against these things or help to overcome these barriers. I think you have to click it again, don't you, Liz? There they are. Okay, so we work with what I'm sure you've all heard of, shared decision making as a participant part of their treatment is being involved in the discussion about what decisions are to be made regarding their treatment and in general about their life. They have to be part of it so that, you know, their voice is re-emphasized and given more weight by the team, by their family, whoever. Of course, we provide as much information and resources. Peer support is big on getting our hot little hands on opportunities that are low cost, finding ways to borrow or connect to these community resources and offer things like that YMCA discount, anything we can do to help alleviate that burden that's financial. The same kind of applies to transportation. We talked about Uber Health the last time, a couple of sessions ago, which is something that I believe that I don't know if anyone has a follow-up on that, please drop it in the chat, but I think the agency has to sign up for it to provide Uber rides to their participants for free. Carpooling, we have a car at Oasis that is a state vehicle that's just for transportation of our participants and, for me and my C's support to go into the community with. I know another person who works at another CSC program who has a van, and I'm like, I need a van. Generally, and encouraging people to do things like take the driver's ed class again, or whatever it is, if their goal is around being able to transport themselves. And sometimes we have to schedule things later in the evening because people rely on parents who are working to come to those things. And then the one that's I think is always going to be daunting for us as providers and supporters is the public prejudice. But these ideas here with like having public meet and greets, providing education to the public, and storytelling sessions and things like that, I think I've seen some interesting change and growth happen. There was actually one of my peers was actually involved in a panel at Duke University that was just storytelling about schizophrenia and homelessness. And it was just available to whoever in the community wanted to come. And I think generally getting these stories out there is, and humanizing the experience and taking it away from the stigma ideas and like the media or whatever is a huge part of reducing that stigma overall.
Thanks for these great ideas, Bodhi. We're going to go through this next fundamental fairly quickly because we have been sort of referencing it in other fundamentals. This idea that we need to maximize the use of mainstream resources. And this is the idea that we need to be supporting people and using resources that any citizen in the community can access. Employment services or leisure recreation resources, gyms, libraries, etc.
And then peer support is part of that. I know a lot of people are familiar with peer support connecting to resources for care or housing or finances or whatever. It's also part of our scope of practice to connect in a professional context with like other community resources, other groups, other spaces, with respecting our boundaries around the communities that we are a part of. Like, I'm not necessarily going to invite my peers to the same support group that I go to as an attendee. But we that's part of our scope of practice is to connect in the ways that we can and maintain our own healthy connections as well.
Yeah, sure. So as Bodhi mentioned before, limited resources, limited staffing is something we've heard from CSDs about promoting use of these resources. But the evidence really supporting this is that there are many more resources available in the community than we'll ever have within the mental health system. We're never going to have enough funding within the mental health system to promote physical health and wellness, education, work, etc. And we really need to look for services that are available and that everyone can access. The availability of these services as well, or these resources, increases people's ability to use them later after they've graduated from the program. So this is perhaps the more sustainable approach as well, although it does take time. We do recognize that it takes time, it takes staffing to be able to make these connections. But here are some examples, and here are some strategies that you could consider trying. First is having current information about what's available in the community. Some teams might choose to have what we might term a community inclusion specialist, or a dedicated person that is routinely researching what current opportunities are available and connecting with various resources. That might be your peer specialist on the team, or it could be another team member. Other teams have more of a team-based approach to this. So various team members are sharing in this responsibility of obtaining current information. An efficient way to do this as well might be to make a focus on community participation a part of ongoing outreach efforts. As we know, many programs are funded to do outreach as part of the work. So this could be built into those outreach conversations that you all are having anyway.
I felt it was my duty to also make sure people are aware that while peer supporters are an excellent way to establish this outreach, it does mean you need to make sure that that peer worker can set aside time, or maybe you have enough peer workers on your staff, whatever it is that you can do, to allow us to go into the community and make those connections without having our peers with us necessarily, because sometimes we do make connections ad hoc, while we are with a peer out there helping them sort of, foray into what they're interested in. We get to make that connection as well, which is really cool. But I also don't necessarily want to tell people who, oh, I'm this person's peer support specialist. I don't, first episode psychosis clinic, like that's not HIPAA compliant or very supportive. So and there are cases where it's more appropriate for us to go do proactive outreach without a participant with us. So you do have to make sure that you are proactively allowing for that time, and encouraging a peer support specialist to do that in both peer services and separately as a representative of your clinic or your organization.
Really good point, Cody. So just another quick idea on this slide is developing these partnerships and ideally reciprocal relationships with these community-based resources. And this again is a list of different kinds of resources that are typically available in the community. So the last fundamental that we'll discuss before we turn it over to the breakout rooms is fundamental number 11, the need to establish welcoming communities. So here we're really talking about this question of how do we work with communities and society to welcome and embrace people with lived experience? What are ways to create a community that says, we want you here, we need you here, you're better off with us? The evidence for this fundamental is that when people are more connected within a community, they have more people that they can turn to support. So this is consistent with this notion of social capital, social support, and that has positive benefits for physical and mental health. So it's good for the individual, but it's also good for the broader community. We know that communities that are more inclusive tend to be stronger communities. If we look at this from an education perspective, more inclusive communities are more likely to have a greater diversity within the workforce, more people contributing to the work, so greater productivity and greater job tenure. There's more likelihood that people will stick it out in the workplace. So again, community inclusion is good for everyone. And here are some ideas for CSCs to help make communities more inclusive and welcoming. Again, you can use outreach as an opportunity to establish connections and provide education about the importance of community participation. Part of these discussions could also be highlighting the unique strengths and capabilities of young people within these programs. As we all know, many of the young people that we serve have a lot to offer other people. And we can also create demand for their increased presence and participation by demonstrating ways that they can contribute.
And then I did want to address, it's sort of a nuanced topic of using peer supports to establish these connections, warm connections with community spaces, which might otherwise be not just uneducated about the diagnoses that we work with, but actively afraid of or excluding them, because we use self-disclosure as part of our work, as much as we're comfortable with. Obviously, we all have to make the same decision about whether or not to disclose as anybody you work with, but we are generally more comfortable with it because it's part of our job. Community spaces, might encounter those who aren't maybe as socially functional as we have been able to become. But generally, I think, every participant might not be the same as us, but we have that opportunity to reduce stigma at the outset of outreach efforts. It's kind of complex, though, the issue of self-disclosure and what your peer support worker is comfortable with. So it might require the presence of both a peer support specialist who can comfortably disclose and a clinician, because that, I don't know, might be something that communities are more receptive to. Ultimately, I think the programs really, you just have to use your best judgment.
Thanks, Cody. So at this point, we've gone through our discussion of the fundamentals, the remaining fundamentals, and we're going to break out into breakout rooms. Cody, did you want to say a few more words about the breakout rooms?
Oh, yes. Where we'll put you in breakout rooms. Hannah's going to drop a image of these questions in the chat that'll include the fundamentals as a reminder. But the questions we wanted you guys to talk over, if you were willing, is which of the fundamentals that we've talked about today do you feel like your team is actively putting into practice routinely, effectively? What's working well? Conversely, which fundamentals would you like to focus on more, or would you like to improve your implementation of? And do you have any specific actions or ideas for implementing this? And what barriers might you anticipate? And how do you think maybe you could get around them, or maybe someone else has gotten around them?
Great. So in a minute.
Thank you, Hannah. Welcome back from your breakout rooms. Okay, guys, just for the debrief, I want to take a few minutes, and I'd love to hear what anybody would like to be voluntold to share from their group discussion just now on these topics. So feel free to either unmute if you're feeling froggy, or use the raise hand feature, or whatever works for you.
Boy, we're a talkative group today.
I was going to say, it's
yeah, it was interesting. We had a discussion about barriers, and obviously one of the key things is having enough staff, having enough money, and having the resources there to be able to do all the work that we would love to do. And someone did start to mention about a clubhouse in Hawaii, but she never got to finish her sentence because we went back to the group. But I think those clubhouses are great.
I love that. I have a friend who wants to open a clubhouse model, actually.
Yeah, I like clubhouse models. We used to have them all the time in Philadelphia, but they don't anymore.
Oh, wow, really? That's interesting. Yeah, they're kind of up and down in their popularity, I guess. But anybody else have anything they want to bring up? I like to hear that. I know we all are. Wish we had the resources to do everything we want to do, but.
Would you be able to talk more about the clubhouses? I'm not familiar with that.
Lori, do you want to do the honors since you guys were talking about it?
Well, clubhouses are a way for individuals to get together with a shared experience, sort of like we were talking about separate support groups. Well, a clubhouse is the type of place you can go and drop in at any time. Well, within the hours of the clubhouse. Usually they do have hours later in the evenings, but it's just peer to peer, and it's a safe place for people to go, safe place for people to say, hey, do you know of this in the community? Do you know about this in the community? Are there any job openings, and things like that. So it gives people social skills and life skills that you may not have gotten if you just put them in the community. And there's various names for clubhouses. They can also be called self-help groups and
Your living
New Jersey.
rooms.
Yeah,
They call different things.
Youth access centers is another way to kind of refer to a similar model, and those are growing in popularity now. I know there are a lot in Massachusetts in particular. But yeah, these spaces where youth can drop in, don't necessarily have to have a formal diagnosis, but may have similar kinds of experiences. And they also do typically offer some programming around skill building, connection to community-based resources outside of the clubhouse or access center. So they can be great resources.
Cool, thank you. I'm gonna look up and see if we have any near us.
Kimiko, I see your hand is up.
Okay, I am the one who we started talking about the clubhouse and I work in a clubhouse in Hawaii. And then actually, unfortunately, I was talking about the challenge that we faced as to hiring a peer specialist at our clubhouse. Fountain House, New York, which is the first clubhouse, they have peer specialists already that they've been implementing. So we wanted to implement, hire a peer specialist. We are having a peer specialist as an intern right now, and we liked him very much. So we wanted to hire him. So I asked the director that if we could hire him, and the director said she agreed with my opinion. However, we are running under the state of Hawaii, and so the state of Hawaii, they don't hire a peer specialist unless we reduce the number of staff.
Okay.
So,
Yeah.
and we're short of staff, therefore, already short of staff, and then it's very difficult to hire specialists. So that's the area I was going to talk about it. However, clubhouses in general are very how do I say, congruent with this peer specialist having space, because the model itself started out the peer group. Peers meeting at the stairs of New York Public Library, New York City Public Library. That's how the clubhouse model was started. So we're pretty much congruent with the peer specialist. And also one of the staff role is an opportunity maker. For example, a staff would take a member to a karate class first. And then the member liked the karate, and then he started going to taking this class by himself. So that way we are trying to make opportunities. However, given time conflict constraint, we cannot do that all the time, taking members out to the community. So that's why we need a peer specialist right now. But there are some barriers. Thank you.
Thank you so much, and good luck. I know there's a lot of people who are only hiring peer specialists because of grants that are available, and I am lucky I don't have to deal with that. I don't have to deal with budgets and grants and stuff, but I know that there are several CSE teams in my network in North Carolina who, my position's official now, like my agency pays for my permanent position, but a lot of us are still grant funded, so it's like they need to experiment. Hope, I see your hand. You're on mute. I don't know, but if you want to go ahead.
All right. I'm sorry.
There you go.
I'm doing this from my phone because I've got a event I have to do. So I was telling the people in my breakout group that I don't do it in my actual job, but what I've done is I have a team. It's called the Phoenix Accessibility Team, and we focus, I guess, the other way. We focus on getting organizations in our community to become inclusive. We do trainings for their staff and board members, teaching them disability etiquette. They kind of get a disability overview, person first and person first and identity first language. And we talk to them about, we bring attention to them about the statistics of the prevalence of disabilities. We even look intersectionally, whether it's LGBTQ plus or African American community or whatever organization we're working in. And we pretty much tell them, if you're not seeing 1 in 4 or 1 in 3 or 1 in 5, you know, what are you doing? Because we're here. So what is, yeah, and I also talk about Maslow and everybody having this need to have a sense of belonging.
Mm-hmm.
When I work with the YMCA, we do kind of an audit to make sure that everything is physically accessible, but then we jump and say being accessible is not the same as being inclusive. And what does it take to create an inclusive culture where people with disabilities will feel welcome and safe to come in, to join in, to interact with the people in their community? And I explained to them the reason they're not seeing them isn't that we don't want to go. It's the reason you don't see them is because there isn't that welcoming, inclusive environment. And that includes in the colleges, that includes, I was telling them we just did the Delaware Pride Festival. So we also have teams, and most of them are volunteers. They go through 8 hours of training, and their whole job is to be there and be present for people that have disabilities, whether they pre-registered or not, that they know that there's a place that they can go. So one of the things we do is we have an accessibility tent at the front and an accessibility tent at the back.
That's really cool. Thank you so much. I love that work you're doing. Liz, do
Yeah.
you want to go ahead? We have some time.
Yeah, so great to hear about all these different approaches to creating welcoming communities. We are at the hour, but I did just want to again mention our opportunity for CEUs and technical assistance for those of you who are able to stay on an extra minute. If you do need to hop off, that's okay too. This will be recorded. So for CEUs, we are offering certain license holders in the state of Pennsylvania the opportunity to receive 2.75 credits. You just need to complete an after-course evaluation, and you need to have completed all or attended all 3 webinar sessions. You need to email a contact we have in our School of Social Work. Hannah is going to drop that email address in the chat. For our technical assistance opportunity, we are going to be selecting up to 5 programs at the conclusion of this webinar. So after today, to participate in more concentrated technical assistance with us over the next year. We're not sure exactly right now what this is going to look like. It's going to be determined in collaboration with the participating programs, but it could include brainstorming together about new ideas that you're thinking about implementing to promote participation. We could provide feedback on new initiatives you're undertaking and help problem solve any implementation challenges you're experiencing. And then we could also develop a learning community among us and think together about how to support participation. So if you are interested in doing this, There is a interest survey we'll ask you to fill out, and Hannah's going to drop a link to that in the chat, but everyone who's registered for this webinar will also receive an email with that survey link. So once again, we want to thank you all for your participation. I think this has been a great 3 sessions. Look forward to continuing the conversation, and yeah, I hope this has been useful for you all. Thank you so much.
Thank you, guys.